Hey there, it's Dr. Shaw. So I wanted to answer a question that I was given recently, and that is, why does our face sag with aging? So the thing you need to know is that between the ages of 25 and 30, we have our largest skull volumes. In other words, we have the most skull we're going to ever have. And so that means there's a really tight skin connection to the skull, and it looks young and full and youthful. So as we get older, obviously there are going to be changes from sort of environmental exposures, dietary exposures, sun exposure, etc., that cause our collagen to start to degrade. And so as we get collagen degradation, we lose a little bit of volume in the skin. Another important connective tissue aspect is called the elastin fiber content of our skin. That, of course, changes with time, and elastin basically makes our skin stretchy and snappy. So it's like a rubber band. As the elastin goes down, you don't have the same kind of snap and shrink wrap capability. So what ends up happening is the skull gets smaller and you no longer have the ability to shrink wrap, so things start to hang. And so there are ligamentous connections between the bone and the skin. They're called osteocutaneous ligaments, and we see these ligaments during facelift surgery, and we release them so we can actually move the facial tissues where we need to. But these OCLs are at a certain length, and they are basically like leashes. Well, if they can't retract, which they don't, you can't tighten up. So eventually the bone pulls in enough, it shrink wraps enough, and the tissues can't pull in with it, so they start to hang. And that's why you have sagging tissues with aging. So you can see this little picture right here, and that's a picture of the skull of a newborn. And you can see they've got a really, really large cranial vault and a very small face, and that's why they've got squishy little faces and cherub cheeks and that sort of thing. Well, this next picture is a picture of somebody who is probably in their 30s to 40s. You can see their face has grown out a lot, and that's that time I'm talking about when we have the most skull volume, and that's when you look the youngest. And this last sort of CT scan picture is of somebody in their 70s. Again, the face is shrunk, the skull volume for the cranium is big, and essentially they are hanging. So this is why we have sagging facial tissues with aging. I hope it helped.